Do you suffer from excruciating pain, inconvenient inflammation, persistent chest pain? Well, you're in luck. Clinicians from around the world have all agreed that this miracle pill will change your life. People who have pesky pain, fever, inflammation, and want to prevent heart and strokes may be eligible. Hi, I'm Dr. Miho, and I want to introduce to you ASA, also known as aspirin, Bayer aspirin, and Ecotrin. You may be wondering how the magic of ASA works. It inhibits cyclooxygenase enzymes, reducing prostaglandin and thromboxane A2 production. In other words, clot formation is inhibited. Side effects are minimal. To all my diligent nursing fans, I'm going to give you an inside scoop on how to give this medication to your patient. If you're a nurse and wanting to give this medication to your patient, you need to assess for signs of bleeding, gastrointestinal distress, educate patients about the importance of following dosage instructions, potential side effects, and when to seek medical attention. You need to monitor renal function and blood pressure in long-term use, and instruct patients to inform healthcare providers about all medications they are taking to avoid interactions. If you want to have an even more in-depth knowledge, you can purchase the full course on my website, totallydrmiho.com, for a one-time payment of $300. Drug interactions include increased bleeding risk with anticoagulants, other NSAIDs, corticosteroids, may reduce the effect of some antihypersensitive medications, may increase the risk of bleeding with warfarin, heparin, and heparin-like agents, and ibuprofen may negate the cardioprotective antiplatelet effects of low-dose aspirin. Side effects are and can include GI ulcers, increased risk of bleeding, hypersensitivity reactions, acute kidney injury, possible hypertension, GI bleeding, dyspepsia, epigastric distress, nausea, abdominal pain, anorexia, hepatotoxicity, vomiting, and allergic reactions. In other words, perfectly safe.
Welcome to Dr. Miho's Patient Education on ASA. First, let's start off by understanding aspirin. Aspirin belongs to a group of drugs called salicylases, and it works by reducing substances in the body that cause pain, fever, and inflammation. It is also an antiplatelet agent, meaning that it helps prevent blood clots from forming in your blood vessels. There are a multitude of reasons why someone may be on aspirin. For example, it might be for pain relief, to reduce fever, or to treat or prevent heart attacks, to prevent strokes, or for its anti-inflammatory properties. Please pay attention to the correct dosage as prescribed by your health provider. Please do not exceed what is prescribed. Timing of taking the medication is important. For example, it should be taken with a full glass of water, with food, or after meals to minimize gastrointestinal discomfort. Keep track of your symptoms and schedule follow-up appointments as necessary to monitor your condition and the effects of the medication.
Precautions should be used in allergies to NSAIDs, bleeding disorders, children with viral infections, patients with asthma, gastrointestinal diseases or kidney impairment, history of GI bleeding or ulcer disease, chronic alcohol use or abuse, severe hepatic or renal disease. It is also contraindicated in hypersensitivity to aspirin or other salicylates, cross-sensitivity with other NSAIDs may exist, and bleeding disorders or thrombocytopenia.
I have truly never felt better. Dr. Miho is a miracle worker. Thanks to ASA, my cardiovascular risk has decreased. An ASA a day keeps the infarctions away. I feel like I can run a marathon now.
I was so worried about developing heart disease. Dr. Miho calmed my worries right away. All my family is on ASA now. Thank you, Dr. Miho.
I've been in and the hospital for years, and every doctor agreed I was a hopeless case. But Dr. Miho knew what to do right away. Within a week of ASA, my blood has never felt thinner. Thank you, Dr. Miho.
Call 800 Heart Attack now to get your ASA.